everyone, you are welcome to Doctor in the House right here on Channel One TV. And of course, my name is Chris Carter, and I'm so excited to be here with you. If you're just joining us for the first time, this is the show I like to call the consultation before the main consultation. That's you having to go to the hospital. And also, I feel like it's a mini, very tiny, itty-bitty, tiny medical school, where you get to learn a lot about your health and also how to manage some diseases or some conditions that you might be encountering, or even get to learn new things. Anyway, so today our doctor in the house is Dr. Augustine Derry, GOA 2024 Best Optometrist, Fellow of the American Academy of Optometry, and optometrist at the Third Eye and Vision Center. And today is all about some of the common eye problems or diseases that people have while aging, or people encounter when aging. So as we grow older, our body changes, and you know, our body changes, yeah, like I already said, and also it also affects our eyes sometimes. So today we're going to be looking into that. So if you have any questions, feel free to send it on the WhatsApp number on your screen, and we'll get to ask the doctor in the house. Hi, Doc.
Hello, Christine.
How are you?
I'm doing so great.
So last week we talked about we started this whole eye conversation.
Yes.
And we talked about our eye and the digital lifestyle. But today we're going to be talking about what happens to the eye as you grow older, and and what are some of the problems that people encounter while growing older when it comes to the eye. So let's get straight into it.
Okay.
All right. So, Doc, why do people struggle with their eyes as they grow older?
Well, they say usually that everything that has a beginning has an end. Yeah.
So our eyes ending?
Well, we started life and in this physical form, and so there will definitely be a time when we will end it. And so getting right into it, our eyes, or even the body, the cells in the body, have a way of keeping themselves healthy and maintaining themselves. But as time goes on, some of the processes for keeping them, number one, the environment that we put ourselves through, heat, chemicals, the things that we feed ourselves with, lack of or too much of exercise, other things can also hurt.
Lack of or too much?
Yes.
Oof.
Yes, there is such a thing as too much exercise.
So there should be balance.
Oh yes, everything is normally best done in moderation. Yes. So the lack of exercise, or if there is more, which is usually not, we don't hear of it a lot.
Yeah.
All these cause changes in the eyes, in the body, but here we're talking about the eyes primarily. So these changes would then cause their function, or the function of the eyes, to decline.
Right.
Yes.
Okay. So at what age should we actually begin to start taking our eyes seriously as we age?
Well, I'll put it in a funny way. As soon as you have eyes, you should take care of them. So what I'm trying to say essentially is that children, newborn children, when they are born, first 6 months of life, there should be some eye examination of a sort.
We don't do that.
I know we don't do that. A lot of people, when I say this, it sounds new to a lot of people, but just for all of us to know, the first 6 months of life, you should have some sort of examinations.
First 6 months?
Oh, yes, within the first 6 months.
We've been making mistakes.
Yes, but I'm sure that I wouldn't be surprised if most of our health facilities would do that, but not really. Parents may not really see that. Yes, so first 6 months of life, at least the first exam.
So I think that is that one that they put in the eye. It's like a small light.
Oh yeah, we can use the lights to try and check the eye, look at it, the appearance, its movements, several other to try and check the back of the eye to see that it's okay, it's what we are expecting. So the first 6 months of life. After that, if you make it a habit to just go in periodically, say yearly, I understand that some people would say that, I mean, the time, the money, and all of that, but it's a good idea to do it every year if you can make it. But then, as we grow, you know, we can do, most people do their eye exams 2 years, every 2 years, because we advise that you should wear your glasses for no more than 2 years and then have another check to see if you should change it or still maintain it. So most people will do it in 2 years. But when you hit the age of 40, someone sat somewhere under a tree and said life begins at 40. And it's quite a very interesting statement, because at that time you realize that there are lots of things, not only in your health, in your career, your finances, in several other areas. Lifestyle. A lot of things change. I would advise that, especially from the year 50, try and have a yearly exam to be able to check these things from the year 50. Right. But a lot of changes, the noticeable ones, start at 40.
Yeah, right. Yeah. So what are the earlier signs of, you know, people, what are the earlier signs that people get that they often ignore as they grow older?
Some of the earliest of the signs we would see: not being able to read at close up. Usually for that, I mean, the women are better at owning up that, oh, I can't do this, I can't do that. The men are more stubborn. So if you notice that you have to increase the brightness on your phone to be able to read easily, or you have to increase the font size of the characters on your phone, it is not normal. I mean, you shouldn't think that, oh, it's normal. No, it is not normal. Just rush quickly to the nearest clinic, eye clinic, and let us check you out.
And this is the one they call
presbyopia.
Presbyopia.
Yes. So what happens in presbyopia is this. Like I was trying to explain last time, there's something we call the lens in the eye. Okay, this lens has these sort of strands, we call these zonules, and then these are attached to muscles. I talked about muscles last week when we came. So this lens has a shape that it changes given, you see the way I'm moving my hand, it becomes more convex, less convex, as we change our vision from one direction or one place to the other. Yes, the white one, and that white thing that was...
You can actually stand. You
know? Oh, yeah, okay, sure. So this is what I'm talking about. Right. This is the lens. Right. But this is cut to just let us see the various layers
parts of the lens.
Yes. So that lens, okay, since I can stand, this lens, light comes in here, and this light comes to a very sharp focus at the back. Right. You remember the ray diagrams that we draw, and then we let the light come to a sharp focus. So this light comes to a sharp focus at that red to orange part called the retina. Now, this lens that you have seen there adds on layers as we grow. So you see there are layers in it. Now, the layers that are being added would decrease its flexibility. Elasticity is the word I was looking for. Yes. So as the elasticity is decreased, your ability to focus is affected. Wow. So the lens actually would lose its elasticity as we grow. Every decade has a specific amount of elasticity that you lose.
And does it always happen to everybody as they turn 40?
Everybody. It happens to everybody. But some people can get a little respite, I'll say that. So presbyopia happens to every single person. Yes, every single person.
Maybe I've started experiencing it, but have you experienced it yet?
Have I?
Experienced it yet? Maybe I'll get to know your age if I
No, I'm not presbyopic yet.
Yeah.
No, I am
not. But it will happen to everybody.
It will happen according to natural order. Right. It should happen to everybody. So when this happens, it's noticeable by 40. 35 to 40, the signs start, but 40 going, you start to notice it. So this is where the men say, oh, I'm fine. And, you know, they are trying to vim, but they aren't seeing. Women report earlier. This is just by my own personal observation. They report earlier to the clinic for help compared to men. Women come like 40, 42. Men will stall till maybe 46 after he has hit the wall. Yes. Maybe when he can't sign a check properly, then he runs there.
Right. So now let's talk about cataracts. What exactly are cataracts? Because cataracts is also something I hear among old people.
You hear a lot. Cataract refers to the clouding of this lens. So presbyopia talks about the losing of its elasticity. Yeah. But cataract talks about its transparency, how light is able to pass through. So the lens is clear. Light can pass through and then hits the back and we can see. But as, again, we grow, like I told you, chemical processes take place, reactions take place. Sometimes a few deposits remain, sometimes other diseases, several factors, the UV light, you know, damaging the lens. This will cause small loss of transparency, and it grows. So then cataract is, let me say, a condition where the lens becomes cloudy, doesn't allow light to pass through, so it impedes your vision. And it's one of the common things that occur as we age. So presbyopia 1 will happen to everybody. Cataracts, if you live long enough, let me put it this way, our life expectancy, maybe 60 something in Ghana. If you live long enough, you definitely have a cataract. Yes.
So can you see if someone has a cataract?
Not at the early stages. At the early stages, you need a professional to check that out. But when it gets very advanced, you can see it. But a person who has the cataract, like an individual who is suffering from cataracts, will see the signs. And some of these signs, mostly it's not painful, but they see things cloudy, just like I'm saying, a clouding of the lens. So they can... Yesterday, I was having a conversation with a 77-year-old, and she was telling me, Doc, yesterday I asked my children to go and find out whether it's about to rain. Oh, yes, that's how feeling. Cloudy, that feeling, when you are looking through clouds. So cataract has that cloudy feeling. There are different kinds. Some cataracts will make your vision worse in the daytime when the sun is out. Some will make your vision worse in the night or in the darker places.
Right. Yes. So if this is not treated, can it cause blindness?
Oh yes, cataracts can cause blindness.
But
presbyopia. Like a presbyter of a church.
You're going to make me say Presbyterian.
Yeah, it's coined from presbyter.
Oh,
yes.
Right.
You know, the presbyters in the olden church were usually older people.
Right.
The people who took care of it, the presbyters. Right. So opia or opsia, whichever, the sight.
Yeah.
So I would say it's a tease term.
Yeah.
Exactly.
Like an old people's eye.
Yes,
right.
presbyopia.
So can also presbyopia cause you blindness?
No.
Okay.
Presbyopia will not lead to blindness, but it will make it difficult for you to see smaller things at close range, to be able to, what we call, accommodate, focus at near.
Glaucoma.
Glaucoma
is it for old people too?
Glaucoma is not for old people. Glaucoma can occur in all age groups.
So what about cataracts?
Cataracts can also occur in all age groups. However, cataract is more common.
Yeah, as you grow older.
Far more common. If I see cataract in a younger person, I would want to actually really interrogate.
Exactly, to know what's exactly going on.
Yes. Glaucoma we find more in younger people as compared to the number of cataract cases you find in younger people. Yes. So glaucoma, yes, can cause blindness. But the difference, there's a difference between the two.
Yeah, yeah.
Cataracts cause reversible blindness. In fact, cataracts are the biggest cause of blindness in the world. But I'll add the word reversible.
So it can be reversed.
Yes, the blindness can be reversed from cataract
if taken care of it.
Yes, yes. Yeah. So what we do is that for cataracts, there is, as at now, there is no medicine that will take away all the cataracts from your eyes. There are several treatments that have tried to, do something to it and all, but we have not achieved any success. Right. It's an age-related issue. So most people come to my clinic when they have cataracts. They say, "Oh, doc, can you give me some medicine that will, take the cataract away?" And I tell them, "Oh, it's something actually related to age." If people are telling you that go and take the, these local preparations, herbal preparations, or people at the street corners telling you, "Oh, to take it off," I think I need to say the tree word here. I mean, so a lot of us can understand. People call cataract ete in the Chi language. I can't tell for the others, unfortunately. Yeah, but ete does not go by drugs. Cataract does not go by drugs. To deal appropriately, we would need to remove the cataract. I'm choosing my word carefully.
Yeah, by surgery.
Yes.
So is it a complicated surgery?
No, not at all. Cataracts are one of the commonest surgeries you would find.
Okay.
Yes, it's usually not complicated because it's a human endeavor.
Yeah.
I can't say 100%, but if you have with a comfortable, okay surgery, I've seen a cataract surgery. Been in the room. Cataract surgery is done in 15 minutes.
Oh, okay.
Yes, 50. So let's give us between 15 and 30 minutes.
Right.
Surgery is done, and then you can see again.
All right. So what about the one called macular degeneration?
Oh, I see you've been reading.
Yes, because I knew we were coming to talk about this.
So yes, these are common diseases that you are mentioning that occur as we grow. Macular degeneration. Let me show the macula. So the back of the eye again is where we call the retina.
Okay.
The back where the light goes from the lens to the back. That's what we call the retina. Now, there is a portion of the retina that we use to see most of the time, the central vision. We call that the macula. The macula is the region, again, this one we are going to school small.
Yeah.
So the retina is the bigger circle.
So that's the round circle?
Yes.
Yeah.
In mathematics, if you have a big circle, not even Venn diagram.
I'm not very good in mathematics, so don't go there.
Let's draw a big circle.
So just stick it to science. If you go to
let's
mathematics, I'm lost.
Let's do art.
That will work.
Aha. So we draw a very big circle. That's the retina, where light falls on when it enters your eye. Draw a smaller circle in the big circle.
Okay.
Call that the macula.
Right.
That's most of where you are using to focus.
Okay.
Because the periphery is where if something is just on the side, you can see. That's the full retina. The macula. Now the inside of it, there's a point where we call, you would have heard of it and forgotten, yellow spot or fovea.
Yellow spot
or fovea. Anyway, the macula is the most important region we are talking about now. The cells there can degenerate, unfortunately, so they don't work as well as they should.
Is it an old age thing too?
It usually occurs as people grow. Not for everybody.
Yeah.
Yes, but it's something that can be inherited, something that can also start even when there's no family history of macular degeneration. Yes. So this will actually affect your central vision.
Right.
So if in a very developed or advanced case of macular degeneration, the person may see you, but he will not see your face well.
Oh, wow.
Yes, because the central vision, when I look at you, the central vision is where I'm using to focus. Yeah. The side.
So they can see the sides, they can see everything in the side, but not.
The central vision is most challenged.
So can it be fixed?
It can't. There is no cure for macular degeneration, but there is treatment available. Yeah. There is treatment with special vitamins that we use to help the back of the eye, or injections, depending on what the case is. Yes, it can't be cured.
Right. What about the diabetes, the diabetic eye disease? Okay.
Well, before you even before we do that, we spoke about glaucoma. Yes. I think glaucoma, cataract, and then macular degeneration. With the macular degeneration, like I said, the central vision is most affected. But when it comes to glaucoma,
yes, I think I know that.
It starts.
It's the outer that starts getting dark.
Exactly.
It starts coming.
So it starts. You start losing vision from the peripheral into the middle one.
Yes. So and then glaucoma, it just closes up, and then that's it. And then you're blind, and then it can be reversed.
Till you have the tunnel vision, and then So that's what glaucoma does, unfortunately. Now there are, after all this, growing up, you become susceptible to different diseases. Yeah. They ask you are at work. Maybe somebody is watching me now. He's at his workplace. You have PPEs that you should use. Personal protective equipment for those of us who don't understand. If you work in a hazardous environment or a potentially unsafe environment, you are given things to protect you. You are there saying you have experience. You will not wear.
You won't wear it.
You won't wear. Or
you won't protect your eye.
Yes, you won't do it. These are some of the things that you accumulate injury to your eye little by little, and later you start to pay for it.
And sometimes you don't even feel that you're accumulating.
No, you don't. You don't feel it, because when that happens, it seems like the eye or the body heals. The eye is healing.
Sometimes you just rub it off, or you use water, and that's it.
Yeah, you're actually doing yourself great disservice. So these things would lead, and then these and lifestyle issues can lead to some diseases. And now here's a news flash. The eye is a very good, let me put it this way, diagnostic indicator of systemic diseases.
Yeah.
So the eye is like the dashboard of your car. That can indicate that, okay, there's no fuel,
wrong.
there's this, there's this problem, go and check engine. The eye can give us signs that can make us, you know, tell that there may be something wrong. So if that is the case, if you have issues like hypertension, diabetes, other chronic diseases, and you don't pay attention to it, what will happen is that you can have complications in your eye. And that is where we now land on the diabetic eye disease or diabetic retinopathy. So diabetic retinopathy is a complication of the disease diabetes in the body that affects the eye.
Right.
So
can it be prevented?
Oh yeah, it's totally preventable actually. First of all, just don't be diabetic. And if you are diabetic, make sure you adhere to treatment. The sad thing is that for chronic diseases like hypertension, like diabetes, most of the time people take it and they say, I don't feel anything changing. It is not spectacular results we are looking for when we are treating chronic diseases. Even with treating glaucoma, you will not feel any spectacular change. But when you stop your treatment, you are actually harming yourself. Yeah. So diabetic eye disease, diabetic retinopathy in particular, we have the retina of the eye that is affected by this diabetes.
Can you fix it?
Depending on the stage. Yes, you can do something about it. So let me go a little bit into it. So let me jam up hypertensive retinopathy. Oh, now there you understand.
Oh, there's a hypertensive one and there's a diabetic one.
There is. Retinopathy is simply a disease of the retina or something, the retina being pathic.
Right.
So pathology, study of disease. And hypertension can cause retinopathy. Diabetes can cause retinopathy. So the blood vessels that you see like this, the vessels can start to leak, you know, leaking this fluid onto the retina. There are certain things, deposits may form, cotton wool spots, a lot of other problems, and this will affect the function of the retina. So that's how diabetic retinopathy begins. And you know, if it progresses, you can have a full-blown diabetic eye disease. Because the diabetic retinopathy is not the only way diabetes affects the eye.
Right. There are different ways it does.
Diabetes can also increase your risk of cataract or the progression of cataract in your eyes.
Doc,
yes.
It's getting interesting and scary at the same time. But then we have a question here. So we have this one from Tamale, Saeed from Tamale. He's saying, please ask the doctor in the house, what condition is it when your vision is blurry from time to time?
Oh, it's blurry from time to time. This could be a condition, or this could be, like we discussed last week, computer vision syndrome.
Lifestyle.
Maybe lack of lubrication in the eye. There are certain things that must be there for clear vision. So if your eyes are not well lubricated, they are dry. Whenever they are dry, to be a bit blurry. But when you blink, lubricate it, or get some supplements,
when I put my
you see clearer.
I see clearer.
Or you are stressing too much. You are overworking. Your eyes are getting tired. Or you actually have a refractive error. We'll deal with this in another time, and you may need glasses.
Right.
Yes. So he should seek. Go to the nearest. He's in Tamale. Or there are several clinics around.
All right. So we have another one. Please ask the doctor in the house. What condition is it when one eye gets red? One's eyes get red.
Okay. Redness is a sign of so many different things. I mean, it's very difficult to pinpoint one condition, but if only one eye is getting red, it will not be, I'm just assuming here, almost taking my seat out of the doctor's seat. It may not be the common Apollo or whatever you have. It may be something actually happening. One eye red, please quickly go to the hospital.
Right. So Akosha from Kaswa is asking, what does it mean when you make up and your eyes hurts?
You make up, your eyes hurt.
Yeah.
Your eyes don't like the makeup.
Oh, so stop.
Stop.
Girl, stop.
You could just be reacting to the makeup, the ingredients in the makeup. Could be an allergy reaction.
Doc, one day we need to talk about eyelashes and makeup too.
Well, actually, yeah, we'll talk about cosmetics and the eye.
Ooh,
yeah,
that's going to be a very, very interesting one.
Yeah.
I am really enjoying this conversation. But lastly, let's get to know what do we have to do to protect our eyes as we age, or what are some of the things that we need to do as we age to protect the eye?
Okay, first of all, the most important thing is we need to do lifestyle changes. This, for me, one single most important factor in health. If you are smoking, stop.
Okay.
If you are not exercising, start to exercise. Myself, I mean, I was an athlete back in SS and all JSS. I realized that my body is changing. So yes, I've started some little exercise because it's a very bad exercise. You should eat well. Dark, green, leafy vegetables, grains, fruits, they are very good, I mean, for the eye. And then you should practice good eye hygiene. Wash your face regularly for no reason, because you take away these bacterial infections and all. Use protective lenses. If they are for occupational use, use that. If it's we're walking out in the sun in a beach, very bright places,
your sunglasses.
Yes, sunglasses are very helpful. If you are at the computer, yes, you should also use glasses that will help you at the computer. These things are, I mean, good ocular hygiene is good. And use adequate lighting wherever you find yourself. Yes.
Right. So, do we have a tip of the day?
Oh, yes. Yes.
All right. So, our tip of the day is...
Yes. So, keeping healthy does not benefit only your body. It protects your sight too. If you are not diabetic, you are not hypertensive, you don't have any other thing, your sight is being protected. So keeping healthy has far more benefits than you think. So make a decision to get healthy today. All
right, so let's get straight into it. Doc, thank you so much. But what is your social media handle, and how can people reach out to you?
Okay, so you can find me on Instagram at August Derry, August the month, Derry, D-E-R-Y. The same for TikTok, the same for X. On Facebook, it's just my name, Augustine Derry.
All right.
Yes, and you can, if you want to reach Third Eye Care and Vision Center, you can just call on 025-6022-833.
All right. Thank you so much, Doc. Ladies and gentlemen, Christine. So we've been speaking to Dr. Augustine Derry, GOA 2024 Best Optometrist, Fellow of the American Academy of Optometry, and optometrist at the Third Eye Care and Vision Center. And it's all about the eyes as we age, some of the conditions that people experience as they age. And he has showed us what to do to protect ourselves, and also what to do if we notice any changes that we have in the eye. Thank you so much.
Thank you.
Thank you for the messages you've sent. This has been Doctor in the House. My name is Chris Carter, and see you next week.